And welcome back. Joining me now are some respiratory therapists working really hard at Good Samaritan Hospital. We have Maria Preston and Erica Baxley. And first of all, ladies, I just want to say thank you. Wow, what a difficult time we are in, especially for a job like yours.
I don't think either one of us ever dreamed that we'd be working during a global pandemic.
So let's talk a little bit about what are you doing now, and how have things changed since COVID-19 began?
Our PPE has changed quite a bit. Now we're wearing N95s and having to gown up and gloves and usually wearing a hair covering as well. But normally we would just rush in to take care of a patient when they call and say that they're short of breath. But now we have to take the extra time to put all of our PPE on correctly and make sure that it's fitting properly before we can go in and take care of them. We have to protect ourselves also.
And so tell me just about some of the procedures then that you do during the day. Like, what is a typical day like for you all now?
A respiratory therapist, I think most people assume that all we do are breathing treatments, but really we see each end of the spectrum. Erica is an alternate supervisor, and in the course of one day she could see patients from newborn babies to maybe an elderly patient that is recovering in our inpatient rehab. My role is as an inpatient bedside educator, so I do education with patients that have chronic lung illnesses.
And when it comes to ventilators and having to put someone on a ventilator, now are you ladies in charge of doing that?
Yes, we are. The respiratory therapists, along with the physicians, are a big role in that.
And so how has that changed? I mean, I know you talked about the PPE earlier. Is it, I guess, a slower process now, a more deliberate process, or has that changed much?
It's a little bit of a slower process. The way we learn to do intubations in school is completely different now. We've changed some things to protect ourselves as well as other people that are in the room during the procedure. We try to minimize how many people are in the room during an intubation.
The ventilator management strategies for a patient with COVID-19 are slightly different too. So we do arterial blood gas sampling to determine the adjustments that we'll make in the ventilator. We also pay attention to their airway pressures to see what kind of adjustments that we need to make to maximize the treatment for the patient.
And then once someone is on a ventilator, do you have to be, I guess, there more often? Are you there, I guess, a lot? I don't know how all of that works.
We have a respiratory therapist that is dedicated to the ICU when we have patients on the ventilators, so they stay on the floor with those patients.
And typically we check on a ventilator patient every 2 hours, sometimes more frequently. It just depends on the situation.
I got you. And of course, if you're not right there monitoring them, someone else is. So they're always being watched over?
Yes. They're on cardiac monitors as well.
And so is there anything that you would like the general public to know about what you do or about COVID-19?
We'd like people to know that we do more than just breathing treatments every day. We work in various settings. Some do outpatient, where they're doing pulmonary function tests or cardiopulmonary rehab, home care. But then you can also, if you want, you could specialize in neonatal, where you could work with newborns or pediatric patients. Some do, bedside education on how to help manage their chronic disease, make sure that they can take their medications properly, and you help people to make sure they can afford their medications.
Yes, and understand their disease processes and how best to take care of themselves at home. I think we want the public to know that while COVID-19 has brought respiratory therapists to the forefront, we work every day of the year. So we're always here taking care of patients with sudden lung illnesses or chronic lung illnesses.
Well, I certainly thank you all for what you're doing right now. You are frontline workers. I thank you also for what you do every day. Thanks for joining us, and stay safe.
Thank you.